Accusations of waste, unfair firings, and the multi-million-dollar deficit, all topics that have put administrators from the Nassau University Medical Center on the hot seat this week. Can the troubled Med Center get on the right track to financial stability, and at what cost? That's the focus of this edition of At Issue. Welcome to At Issue, a program that explores the issues and people that affect and concern Long Islanders. I'm Lee Tyrell. For a time, it looked like Nassau University Medical Center had turned the corner financially, but now NUMC is seeing a lot of red, and so are some taxpayers and the union representing doctors after they heard how much hospitals' top administrators are being paid. News 12 Long Island's Scott Feldman takes a look.
NUMC is not in the financial condition the chairman of the legislature's health committee had hoped for.
The plan was to break even in the fiscal year 2006, and we got a financial report a couple of weeks ago that indicates that there appears to be another deficit looming in 2006.
To start the new year, the Med Center could be $10 million or more in the red. At the same time, the hospital's 15 top administrators are being paid more than $3 million. The medical director, Dr. Stephen Wallerstein, is making $380,000. Right behind him, CEO Daniel Kane at $332,000. So are these salaries out of line? Well, predictably, NUMC says not at all. But others are both flabbergasted and furious given the precarious financial condition of the medical center. Union leaders already incensed over a hospital plan to fire most of the veteran emergency room doctors, saying their training and credentials aren't up to current standards, call the administrative salaries outlandish.
We have this top-heavy pyramid, highly paid staff taking this public benefit corps into the ground, while all the while firing union members. It doesn't make any sense.
And it's bewildering to some Nassau taxpayers.
They're all out of control. They're all overpaid, just like with the supervisors of all the schools.
They should cut back at the top instead of cutting people at the bottom and laying people off.
The Healthcare Corporation says administrative salaries have only increased 2.6% over the past 2 years, below the cost of living standard. We're pleased to have been able to recruit a group of experienced, talented, and dedicated individuals.
And that was Scott Feldman reporting. Now, joining me now for this edition of At Issue is Chief Administrator for NUMC, Donald Kane. Also, Jack O'Connell from the Health and Welfare Council, and Jerry Laracuda, the president of CSEA Local 830. That's a union representing doctors at NUMC. A lot to talk about. It's been a very tense week with developments at Nassau University Medical Center. And Mr. Kane, thank you so much for joining us.
Pleasure
because
to be here.
some of it has centered around you. And I want to start with the most controversial news that came out of NUMC this week, and this was to change their job requirements for emergency room doctors. Tell us about the decision.
Yeah, let me say that in the past few days we've heard a lot from friends of the hospital, members of the emergency medicine groups,
Okay.
Paramedics, who have been consistent friends of the hospital over many years. We have meetings. I have meetings to meet with other ECMS people, paramedics, and we're going to listen to all of them and what they have to say, and then we'll see where we're going.
All right, about your decision is what they've been talking to you about.
Yes.
Where'd that whole decision come from, first of all?
One of our goals for Nassau University Medical Center, we have two primary goals. The first and most important is to put the institution on sound financial footing so the many members of our community who are disadvantaged and underserved can be certain that the medical center will be here for many years to come. That, as I said, is the #1 priority. Along with that is the priority to do whatever we can to enhance the care that we provide and to make all of our services accessible to as many members of the community as we're able to.
All right, so the last news that we heard, though, were that some of the doctors had been notified that pink slips were on the way for them. Are you telling me now that that's not necessarily the case and you might be rethinking that strategy and that decision?
Yes, what I am saying is that as we continue to get input from Friends of the Hospital, we are looking at our plans, and we're going to give serious consideration to the input that we receive.
All right, Jerry, how does that sound to you?
That's the first good piece of news I've heard in a long time. It's very good. I hope that Mr. Kane and his board of directors takes a serious look at this, because they were about to make a big mistake. Our emergency room is, staffed by some of the finest emergency room physicians in the country, I think, and I didn't understand the logic behind it.
Can you give us, Mr. Kane, perhaps the logic behind
Sure,
it?
I'd be happy to. Roughly 62% of all of the emergency room physicians in the United States are either graduates of emergency medicine training programs, residency programs, or board certified in emergency medicine, or both. At the Nassau University Medical Center, of our 41 physicians, of which we have 20 full-time physicians, somewhere around 5 or 7 meet those criteria. And I certainly would agree that we have a superb emergency department, and that we provide excellent care to the residents of the community who
Lee, if I
come
could
to
just
us.
jump in on that.
But where we can enhance care, we want to take advantage of opportunities to do so.
All right, Jerry, before you pop in there, I want to ask you, have there ever been complaints about the emergency care at the hospital?
Well, again, have there ever, of
Okay,
course.
all right. Well, in the time that you've been there now,
No,
have there been complaints about the emergency room
I'd
care?
say in general our emergency room is excellent. There are always going to be a complaint from a person here or there, which may or may not
But complaints about ER care don't plague the hospital.
Complaints, our emergency room is something that is the foundation of our level 1 trauma center, and we're very proud of.
Okay, Jerry, go ahead.
CSEA, we've always maintained that we're not against enhancing health care. And from this point forward, certainly that would be something we would support.
Well, so grandfather it in. From now on, ER doctors hired at NUMC have to have meet that requirement of the 3-year residency and the, in emergency medicine.
Certainly, Lee, if that's something that Mr. Kane and the board and his senior staff think is what is necessary, we wouldn't be against it from hiring. I don't even know if it's possible. I don't know who has these qualifications, because to have both of them, I don't think that's something that many hospitals do have in the area.
Well, we checked with the hospitals, the larger hospitals on Long Island, the day that we did the initial report. Stony Brook, Winthrop, just a couple of them that are popping into my head right now. Oh, and North Shore LIJ. And we were told that those are not their requirements for their ER doctors.
So if they're not their requirements, I don't understand. Okay. I couldn't get why we were making that a requirement. I mean, I did a little research myself, and if we get to that, I'll be glad to tell you.
Okay,
Can I
Mr.
comment
Kane?
on
Yeah,
that?
absolutely.
Yeah, I think it's all how the question is asked, because we've spoken to leadership at a number of those institutions, and who have said that they will not hire emergency medicine physicians who don't meet the requirements. They have varying mixes of physicians who meet the requirements totally or who meet it in part. One of the hospitals, I don't want to name individual hospitals, has all emergency medicine residency trained physicians with one exception. But several of the ones that you named have said to us that whether it's official policy or not, that they're not hiring physicians who don't meet those requirements.
All right. Jack, I want to bring you into this. You're our resident expert here at News 12 on the whole hospital industry. How did this hit you when you heard about it?
Well, I'm glad you put me in between.
Exactly.
Listen, this does not surprise me in the environment that we're in, and I think that we need to look at this from somewhat of an historical perspective, as well as what's going on in New York State. The hospital industry in New York State is really in turmoil financially. This is not limited to Nassau University Medical Center.
No,
certainly throughout the New York metropolitan area, the financial situation is really, really difficult. And it's difficult because we've undergone a major evolution in how healthcare is provided. People don't go to the hospital for 2 weeks anymore, or even a week and a half. It's a very different type of scenario. So under those circumstances, the whole delivery of health care is changing. So whenever I hear stories like this, I'm not surprised, because we're going to be hearing more of these kinds of stories as time goes on. But what I would say is this, is that For a very long period of time, it seemed that that the county government, which at the time was running the hospital, was not hiring qualified, what I perceived as qualified CEOs that knew healthcare. You can't move from selling used cars or selling books and run a hospital these days. This is a highly complex field.
Yeah.
And when they brought Dan in, I was very happy because I think that for the first time there's a plan.
Yeah.
Now the plan has to include process as far as I'm concerned, and I think that's, and maybe that's what Dan is referring to now, because what my friends at the union are saying is we need a process as to how do we get from one spot to another. We just can't make an announcement one afternoon and that this is a change in policy. So I think that this in a certain sense reflects the turmoil that we're all going through in trying to create a new health delivery system, of which NUMC has to be considered a core part of providing healthcare services to especially the indigent and the poor in this region. And it's going to create a lot of turmoil in the future. But we need to have a process by which we can come to some consensus as to how do we get to where we want to go to implement the plan.
All right, let's see if we can talk to Jerry. Just hold on there. I got to take a break. We'll pick it up on the way back. Lots more to talk about with this. There's still more turmoil as far as the audit that came out this week also. Future of the Nassau University Medical Center, the focus of this edition of At Issue. We'll be right back.
Bar none, this hospital's emergency department is the best in the county. They work 10, 15, or 20 years in one of, if not the busiest emergency departments in Nassau County, not to mention a trauma center, which treats more serious traumas than all of the hospitals in the county combined.
Welcome back to At Issue here on News 12 Long Island. We're looking at the Nassau University Medical Center and the headlines it's been making this past week. Accusations of overpaid administrators, some financial waste, and unfair firings. Once again, joining me, Chief Administrator for NUMC Daniel Kane, Jack O'Connell from the Health and Welfare Council, and Jerry Laracuta, the President of CSEA Local 830. And Jerry, I know you wanted to say something just before the break.
Yes, Lee, just to, I have a little disagreement with Jack as he went into his statement regarding the fact that this is the way of the future and things are expected this way, and that, you know, I would almost be in agreement with that, because the difference is ours is a union shop. CSEA has union workers, and we have been very, very helpful to the management of the PBC here. Our
As far as saving money.
I mean, we've given them tremendous concessions here, and we have done everything we can. I mean, and yet, even right in January of '04, right after they laid off 91 more of our employees, after we lost over 900 already, they laid off 91, and then this team came in and hired 6 more senior vice presidents at over $1 million. These are the kinds of things that I'm concerned about. And secondly, I'm very concerned about the plan behind the plan. What was the real reason for this? Because I am told by many people that there's a privatization issue here, that this is a union-busting tactic.
Well, you know as well as I, privatization is something that's always been brought up about NUMC for years and years and years, so that's certainly nothing new on the table. But I'll ask you, Daniel, was it a union-busting tactic?
We have 3,400 members of the CSEA that comprise the staff of the Nassau Health Care Corporation, a great group of individuals, and I think that that's silly.
All right, there you go. You got your response.
That's
You
two
have
good
your
things I've
response to
heard.
that one. Okay, let's talk about salaries, because you know when it comes to the release of administrator salaries, and just like it is in our school districts when we find out how much the supervisors are making, we're talking about a lot of money. When it comes to administrators at NUMC, we're talking about some $3 million. You certainly make a nice salary for the job that you do. And yet the unions at NUMC over the last few years, and remind you to our viewers, Daniel has not been there for that long, only about 2 years so far. They're talking 900 layoffs, 1,000 layoffs for doctors, nurses. There have been a lot of layoffs at NUMC, yet the members of the union see administrators like yourself making comfortable 6 figures.
Yeah, well, let me comment on that. I think Jack set the tone by pointing out that when you have an enterprise, in our case, a $480 million enterprise with 3,400 employees, you need to have managers who have experience in running large healthcare enterprises, who know what they're doing, and can help to secure the financial stability and future of this institution.
Now, so you're all saying you're worth the salary that you're getting paid.
Well, I think that's the basis on which we should be evaluated, and a good person is going to more than save whatever the cost of their salary is. That's one point I would make. Second point I would make is that shortly after I got here, I eliminated 4 positions, 4 senior administrative positions. As an example, we used to have a chief operating officer and a dean of academic affairs. Those positions were eliminated. And subsequently, other new types of positions were created. But if you look at the total cost of all those positions from where they were in 2003 to where they are today, the net difference is the 2.6%. So there has not been any significant additional cost. And again, I've had staff members, members of the CSEA who work at the Nassau Health Care Corporation, come up to me and say, Mr. Kane, thank you for bringing in that chief patient care person who really knows what she's doing. We finally have someone who we can talk to. We finally have someone who makes rounds and talks to us. To me, that's something that we should be saluting,
All right.
not
Well,
criticizing.
you know, Jerry, you have to admit that a hospital needs administrators. They do.
Absolutely, but I'd like to know, I mean, this is a hospital that's losing tens of millions of dollars, so at what salary can we get somebody in to stop losing money?
Well, all right, at what salary can you get somebody who can do the job?
Well, I mean, I believe our guys do the job every day, and I think Mr. Kane already alluded to that fact. He said he has a great emergency room, he has a great staff, he really does. This is the place, if the President of the United States comes to Long Island, as he did 2 years ago,
exactly.
he goes to that trauma center if something happens. That says a lot, because, you know, they're very picky in who they send the
It
President
sure
to.
does. All right. I have to take another break. We'll be right back with some final thoughts from my guest. Stay with us.